Hi,
Hello.
this is Mrs. Loraine Elliott, and I am Dr. Amanda Jones, wellness educator, and we are really happy to have Mrs. Loraine Elliott speaking with us at Stay Well Fire Your Doctor. I just want to introduce you to Loraine Elliott. She's someone that I have been wanting to speak with for years, but she's a busy lady, so this is the first time I've been able to catch up with her so she can share her incredible story for you. Now, what really struck me about this story is it's something that needs to be shared because it's very encouraging, very empowering, and at the same time, almost hard to believe. Except when it's coming from someone such as Mrs. Elliott herself, and she's telling you the story herself, then it really gives you pause for thought. So, Loraine, I'd like you to share with us what happened to you about 12 or 13 years ago, and how you responded and how you were able to turn your life around and learn a lot at the same time.
Okay, well, hello everyone. Amanda, thank you for giving me this opportunity to share my great success regarding my health. It was a long time ago. I can't even remember. I think it's more than 15 years ago. I was about 35 years old when I started to experience joint pain. And it got so bad that I couldn't even bend down and get back up again. I mean, I had to literally hold on to pieces of furniture, and I stopped going to the gym because of that. I couldn't do squats or anything else.
That's amazing at that age.
Yeah,
Did they tell you what type of arthritis it was?
Well, the funny thing is that a few years prior to that, my husband broke his ankle bone, and he went to a specialist, and they did a marvelous job repairing the problem. And I thought I would go to this specialist and find out exactly what was happening with me. And this doctor sent me for x-rays, and then he said to me that I had to have my kneecaps replaced. I was in shock, and then of course the tears followed, and I just could not believe it. I walked away and I thought, what is happening to me, My husband thought I was crazy to even contemplate surgery. And I started researching. At night I would, bring up the internet and start looking for stuff. And of course in those days you didn't have as much as you do now on the internet regarding natural health and, how you can heal yourself with just the foods that you eat, that you consume. So as time went by, of course my situation got progressively worse. And then I got discoloration of the legs. It started out as looked like freckles. I thought they were sunspots.
Which is probably a different problem now.
Yeah. And of course, you're getting on in age and you start to develop all sorts of things.
Yeah, but you weren't 40 yet, were you?
Well, by that time, I most probably was. It was around 40. I mean, I have to sit down and really go through, but it was a long time.
But how were the knees at that point?
Oh no, that didn't clear up at all.
Okay, so that was becoming a chronic problem.
Progressively worse. Yes.
Wow.
What happened was, of course, I started wearing trousers to cover up my discoloration on the legs.
Yeah.
I mean, they used to look like freckles, and I thought, well, okay, there's some spots. You're always in Bermuda shorts. And then, of course, it started to spread and join, and I was chocolate brown from under my knee all the way down to my ankles.
Wow.
And it was actually spreading onto my instep. I started wearing trousers. I went to the doctor. Of course, the doctor laughed at me and thought, hey lady, what problem do you have? I mean, you have a bit of a circulation problem, but nothing to worry about, I have patients who have serious problems, go home type of thing. And I realized at that point that my health was breaking down. And I felt if I didn't take control of it, it's going to just spiral downward. And to make matters worse, I developed acid reflux. I went to the doctor. I was told I had a hiatal hernia. Of course, I couldn't sleep unless I was sitting up. And all this time I continued to do research. I mean, I've researched on every problem that I had. And of course, while I was actually accumulating all these facts, I was still skeptical to really try them. You sort of put everything in a folder, you go back, you revisit them, and you think, would this really work?
Because you're questioning, is it really a fact? You don't know anyone who's tried this before.
Yes, I got a hold of a lot of books. I started reading and everything else, and I thought to myself, well, it's all there on paper, but you don't really hear of people going to these extremes and
Yes.
trying these things.
Successfully.
And I guess, living in Trinidad, a small island, I guess we just wasn't exposed to this sort of thing. But the final straw was when I was having lunch with some friends. And I started having these horrible indigestion problems. I felt as though something was stuck right here in the stomach. And I remember going to lunch with my girlfriends, and of course they were so used to hearing me complain. I mean,
my
it was
Lord.
incredible, but they were good. They were so good. Oh, they never put me off. But then they would sit there, and one of them said to me, one of my girlfriends, she said to me, "You have gallstones." I said, "Oh, come off it. You have to be kidding." She said, "No, you have the same symptoms that I do, and my doctor says that I need my gallbladder out." And that was it. I came home and I said, no way, because I had spent a lot of time in prayer and a lot of time researching.
But did you have proven gallstones, or was this just her opinion?
This was her opinion.
Okay, so did you ever prove that you had gallstones?
Well, I did, yes. What happened was, when I got home, I sat down to think, and I thought, you go to the doctor's office, you got to wait all day. He's going to send you for an ultrasound.
So you go get your ultrasound?
Yeah, and then you had to do all this running up and down. I said, something, let me just try this little remedy on my own. And anyway, I got all my bits and pieces together, and I thought, let me see if I have gallstones or not. So anyway, I remember the first time I decided to do this flush, and I took all this stuff, and there I was running back and forth to the bathroom. I mean, I was going off like a duck. It was terrible. And my husband was a bit upset. He was like, "What are you doing? You don't know what you're doing." And I thought to myself, I said, something? Everything that I am using is natural stuff that we use, natural foods, natural oils that we would use in everyday cooking and eating. So I thought the worst that can happen was I may have the case of the diarrhea or something, but it wouldn't kill me. So I continued on for the rest of the day. I thought I'll see this thing through. Well, lo and behold, 2 o'clock in the next morning, I got up. I just felt like I wanted to go have a bowel movement. Went to the toilet. And I tell you, I just started to deposit handfuls of emerald green gallstones. I mean, it was amazing. It was just, I couldn't believe it. It was incredible. Of course, I kept a few. I was thinking, I was told me whether to wake up the rest of the family or to leave them asleep. And I did, keep back a few samples for them to see. But that convinced me there and then that the body can heal itself.
Yeah, I'll tell you.
I mean, that was incredible.
Of all the stories, of all the things that you share with me, I always find that one the hardest to believe, because I can't see how the gallstones would get, they're so big, how would they actually get into the digestive system?
Yes, okay, well, the thing
from the gallbladder,
is that you, what happened was the stones actually broke up. And you remember, gallstones are not as hard as kidney stones. And so what happens is when you take apple and stuff like that, it softens the stones. It actually softens the stones. So when you pass them, there's no pain. But this definitely convinced me that I was on the right track. And then, of course, later on, and not too long after that, I did my first detox. And I believe in detoxing the system. Of course, you have to know what you're doing, and you have to be on a proper detox program. But I went on a detox for a week. It took me weeks just to get the supplies together. But once I did that, I tell you, up until this day, I don't have acid reflux. I don't have joint pain. And all the coloration has really gone from, don't show my legs, because, but all the coloration has gone from my legs.
Do you want to show the legs?
Not really.
Oh.
But, it really has been a journey for me. And it has been so rewarding and so fulfilling, because all of my friends, they've done detox programs with me. I've helped.
So you've actually administered some of these programs?
Yes. I mean, well, first,
to your friends?
Well, my friends are the ones that got me going. They said, you can't keep this information to yourself. You have to help us. And I've helped family members, and I continue to help people.
And what have you been using for the detox, or is that something you wouldn't want to share?
Well, there's a program that I have. I use a product, but I enhance the product. Every individual is different. And what may work for one person may not really work for another.
But even so, what are some of the key ingredients in the detox?
Oh, okay. The product that I use, it's all organic foods.
Okay.
But one thing, if you're detoxing, first of all, you need to detox. You need to fast when you're detoxing. I know there are a lot of people who detox and eat at the same time. I really prefer that a person fast from food as they know it, to give the system a complete cleanup.
So what would they be eating instead?
Well, it's all in liquid form, and it's nutritional things like it's palm oil, and it's brown rice, and all natural organic vegetables and fruits that are packaged together, and you have it in a shake. Now there are many ways of detoxing the system.
Right.
There's so many ways. I mean, we use lemon juice. And the things that we definitely use when we're detoxing is like bentonite clay. You need to use something that will expand in the smaller.
But those were some of the things you used initially.
Yes.
The bentonite for your own self.
Bentonite and apple cider vinegar and stuff like that. Things that would also help to alkaline the body. What I like with the program that I use simply is that it's a very simple program. You don't feel hungry on it, and that's one of the problems you have when you're detoxing, is that a lot of people don't have the staying power because they start to feel hungry and they cheat, and so it makes it a little difficult. But like I always tell people, I mean, even just starting to change your diet, coming off the soda pop and drinking a lot more water, introducing more fruits and vegetables, and one of the quickest ways is by juicing vegetables and getting the nutrients straight into your bloodstream.
So how often do you recommend juicing, in your opinion, from your experience?
Juice every day.
Every day? Wow.
Every day I juice every day.
Yeah.
I would say that people should start off with at least 2 glasses of vegetable juice. When we're detoxing, I will put you on. We will juice fruit as well, just for the first day. But usually you should eat your fruit. You should, because of the sugars that are in it. But the vegetables, you can juice them. And I've helped people who have hormone imbalance, especially people who are menopausal, who don't have enough estrogen and stuff like that. I mean, you can use things like celery and parsley and get your estrogen. And I tell you something, when you get the nutrients that the body needs from natural foods, you have nothing to worry about. You don't have to worry about, if you're taking too much or what have you, because whatever the body doesn't need, it will expel.
I'd like to ask you a few more specific things, because I'm sure our listeners will want to know how soon after your first detox you actually started to feel a relief of symptoms, because what you're telling us is all your symptoms resolved. Acid reflux, arthritis, symptoms of hiatus hernia, which I guess was, more or less the acid reflux symptoms. The pains that were associated with what you thought were gallstones, and you did eventually do that ultrasound as well to demonstrate the gallstones?
No, actually, I've passed ever so often, because if you're prone to gallstones, I mean, you can get gallstones again. But there's another thing too. A lot of people who have had surgery for gallstones.
Yeah.
And I've had 1 or 2 people who've called me, and 7, 8 years later they have to have surgery again. And what I'm saying is that they're natural things that you can use, but apart from that, what tends to cause gallstones also is that sometimes the gallbladder becomes very sluggish. So it doesn't release the bile like it should. And would you believe that just taking a tablespoon of olive oil 15 minutes before you eat actually stimulates your gallbladder and gets it.
Well, another approach, some people don't care much for raw olive oil. Another approach might be to have your salad first and put the olive oil on the salad.
You can, but I always believe that if you take, the thing is, it has to go through the digestive process. So if you take a tablespoon of olive oil, it goes straight into your system. And you can get used to it. A tablespoon of olive oil is really not much olive oil. And I think sometimes we get squirmish, and we have this attitude towards certain things, but if it's good for our health and it can make a difference, especially if you've been suffering with gallstones this is something that you can try, you know.
I'd say things grow on us. Like initially you may not like the taste of something that's good for you, but then it grows on you if you stick with it, especially if you believe that it's good for you. So you kind of hinted to us that some of the things you did besides the detox was changing your diet. So are you saying that you had a radically inappropriate diet before becoming more conscious, before doing your reading?
I realized that it was the foods that I was consuming that really created the problem. So I had to change. But the good thing about it is that if you do a proper detox, and I'm stressing this because a lot of people say they're doing a detox, but they're not really expelling. If you do a proper detox, what happens is your body starts to alkaline itself. Okay, you're getting rid of the waste, and what you find is first and foremost is that your taste buds begin to change. So there are a lot of foods. If there are foods that you're eating that you feel you should really stay off, then it's a good time to really not go back to those foods again, and you won't miss them. It's amazing. I've had people who have done a detox 3 and 4 times, and things like coffee that made them nervous, they don't touch it again. They don't miss it. And there were a lot of foods that I ate. I mean, I love shrimp. Now shrimp tastes like cardboard in my mouth. So I don't touch it again. I don't eat it.
Your taste has changed.
Your taste buds change. And to me, that is the easiest way than even going on a diet. To just, you know, to remove those foods from your meal plan.
There are a couple of things that you had mentioned to me too that I'm hoping you may want to tell us a little bit about. I think you've told me before about the use of coffee enemas. I don't know if is that part of the detoxification process that you use?
It would depend on the problems that the client has. And another thing too is cancer patients benefit tremendously from coffee enemas.
Do you know why?
Yes, what happens is, remember that if you have cancer, you need to keep your colon clean. A lot of people go and have colonics done or what they call irrigation. I mean, the old-fashioned word is enema. You can do it at home, you know, yourself. You don't have to go and pay someone to do it. But usually, if a patient has cancer, when they go to these clinics, they would tell you that you need to have enemas done or irrigation done, say 3 times a week.
That's at natural health clinics, right?
Natural health
not the conventional.
Yeah, that's exactly it. And what happens is the coffee actually stimulates the colon and helps you to expel easier. And you can add things to it too. My personal take on it is that a lot of people who are, let's put it this way. Remember, when you're doing a colonic or enema, you're putting a tube up your rectum. And this is something that you have to be very careful with, okay?
You mean in terms of the risk of perforating the colon?
Yes, you have to take your time and you have to be careful. So it's something that when we're doing a detox, we do it through the mouth, through the digestive system. So you flush everything out, you take it through the mouth and it goes through your digestive system and it flushes that way. Enemas, because you're putting a tube up your rectum, you need to be careful. However, having said that, cancer patients cannot afford not to have colonics. My take is, if I'm giving a colonic, I think that the patient or the client should benefit by having an implant, whether it's a coffee implant, enema implant, whether it's wheatgrass, because wheatgrass also heals from the inside out.
But does the coffee heal, or does it stimulate a certain type of activity within the gut?
It stimulates a certain amount of activity, and what it does is it gets all the bacteria out. And so this is the reason why a lot of naturopaths outside of Trinidad will recommend it. I have a couple of clients who have cancer and have decided to take the other route.
But you know, raw coffee also has antioxidant and anti-inflammatory properties. Is that any? I mean, what are the theories behind how it works?
Very beneficial for taking the enema. Because, like I said, it's all about getting rid of that waste that is in the colon, and if you not only that too, even if you use wheatgrass, if you implant wheatgrass into the colon, wheatgrass also helps to alkaline the colon. So all of these simple things, I mean, that we can do. I remember as a child, when children were constipated, parents would give their children an enema. I mean, it was the most common thing to
What
do.
enemas did they use in those days?
In those days, they would use warm water.
Ah, okay.
With a little
Alright.
bit of soap in it. But another thing that you can do is you can use warm water with lemon in it, because lemon alkalines the body. It's all about alkalining the body. That's why we detox the body. The body is supposed to be 80% alkaline and 20% acidic. And because of our Western diet, most of us, our systems are so acidic.
When you say the body is supposed to be 80% alkaline and 20% acidic, do you mean in terms of the nutritional balance, like 80% foods that you'd class as alkaline versus 20% acid?
That's because this is where we get it from.
Because the actual pH of the body would be, well, it varies from part to part. Like in the stomach, it's more acidic, and the blood pH is supposed to be more or less the same throughout.
Right.
But then you will find perhaps variations in different tissues.
This is exactly it.
Yeah.
But we're talking mostly about the blood now. And the thing is, for your blood is your life force. And so if the blood is not right, okay, remember the blood is going to take nutrients from the body. And so you need to make sure that you're putting the right foods, the right nutrients into your body. And this is just like when people who get osteoporosis, a lot of people feel that they need to have all this calcium and stuff to have strong bones. But there's another factor that they don't figure into it, and is that if the body is acidic, then the blood is going to, your body is not going to function right in an acidic environment. It has to be alkaline to a certain point. And so what happens is the calcium and the other nutrients in the bones are absorbed by the body, and this is why we have osteoporosis. And if you want strong bones, then you have to be sure that you are alkaline in your body. And there are very simple ways of testing. You can take litmus paper, you can use saliva, or just how they test the urine. You can test your urine to see what your pH is. It is so simple to do.
But I think the pH of the urine is it's in a different class because it naturally has a lot of uric acid in it, so it's going to be acidic.
But I know, but remember, we're still talking about, actually the saliva is the best way of doing it, and you can get the strips and test the saliva. But, if you don't have that, you can, at least it gives you an indication, some idea of where you're at. And we're talking about just, the most important thing here is taking charge of your own health. There are a lot of people who, when they have an ache, they have a pain, they have a headache, whatever they do, they run straight to the doctor, and all they want is a pill to fix it. And what we're trying to tell people here is that you need to take charge of your own health. So there's simple tests that you can do this, and something, one of the best tests is just listening to your body. There are a lot of people who ignore the signs. I mean, you have a headache, you take a pill, and you still keep on going, but you don't stop to think,
yes,
why am I getting these headaches constantly?
Your body's perhaps saying to slow down in some cases.
That's right.
You're tired, you're hungry.
Or you're dehydrated.
Yes.
And that's one of the ways, people get terrible headaches. And you ask them, do you drink enough water? And they look at you like you're mad, and they think, oh, no, too much water, and what happens is I start urinating a lot. And therefore, I can't be running to the bathroom every minute. Yeah,
what happened? We've put our normal functions very much subordinate to ambitions and social norms. I think that's one way of putting it. So the things our body needs are always subject to, if our job or family commitments or social commitments or study commitments can accommodate the needs for sleep and exercise and proper nutrition. And that's a little bit upside down.
Even bowel movements. And
True.
Some people don't
That's a
want to
good
be
point.
inconvenienced by a bowel movement.
Wow. And your bowel movement is there to facilitate you.
But of course.
That's what it's there for. It's there to help you.
This is exactly it, to have optimal health.
Yes.
And so when we start to do the right thing, and what's incredible about the human body is that if you make just one change, just one
Oh yes,
simple
I've seen that.
change,
I've seen that.
you begin to reap the benefits.
Yes, and then
is
it encourages you
amazing.
to go to step 2 and step 3.
This is exactly it. This
Yeah.
is exactly. And you know, you did ask, we sort of gone along the beaten track, but you did ask, how long after you do a detox do you start to feel relief from
Yes.
joint pain and stuff like that? Almost immediately.
So you felt that
Immediately.
very soon after you did your
before,
detox?
Well, I detoxed. The first time I did it was for a week. I usually detox
Okay,
for a week.
so you detox for a week.
Before the week was up, I had no joint pain.
So let me see if I understand. You had pains for some years.
Yes.
So bad that one of your doctors wanted to operate. You had symptoms which you suspected were gallstones, but you never actually did an ultrasound per se. You had acid reflux,
Yeah.
hiatal, what do you call it again? Hiatus hernia, that's right.
Hiatus hernia, yeah.
And you detoxed, and that was it.
That was it.
But then did you ever go back to...
Oh yes,
to,
actually I went to a very nice doctor that I know, a specialist, and I said to him, actually life is so amusing, you know. I went to him and I thought, you know, if I have this hiatal hernia, maybe I should have it repaired because
Yes.
I'm getting older.
Yes.
Even though I'm not getting any adverse symptoms or anything like that.
Yes. And he told you leave it alone?
No.
Oh.
So I went to see him, and because of course I've changed my diet, but I do know that if I indulge in some of the foods that I used to have, after a while, the feeling, the indigestion comes back.
Right.
If I go back to alkaline in my body, I'm fine. So I said, you know, maybe I should have my hiatal hernia repaired. So I went to him and I said, Doc, listen, I just want you to check me out. I'm thinking of having this. I was told I had a hiatal hernia. I'm thinking of having it repaired. He said, well, you know, if you have a hiatal hernia, he said, then you have gallstones.
Oh my gosh,
I said,
okay.
you know, I never equated the two.
Okay.
So he said, I said, really? He said, yes. He said, usually people who have a hiatal hernia have gallstones. So I said, well, I know for a fact I don't have gallstones. Actually, I've
Flush them out, you told him.
And I've had 1 or 2 small stones after that.
Yes. So what did he say and what did he find?
He looked at me in disbelief. He's such a darling. So he said to me, he said, well, you know, he says, when we go in there, we'll decide, but we'll most probably have to have your gallbladder removed. I said, well, let me tell you from now, you're not removing any of my organs. So he said, all right, tell you what, I'll send you for ultrasound.
That's a funny thing to tell a surgeon, but all right then.
Well, I'm not a doctor, but anyway. Well, I just feel that our organs were put there for a reason.
Yes.
So
the surgeon had better have a good reason to take them out.
This is just my take on the whole
Yes.
thing.
Yes, but what happened?
So
Tell us.
anyway, so he sent me for an ultrasound, and I said, okay, fine. So I went for this ultrasound. Before he sent me, he said, you know, when you have gallstones, he said the problem that you have is that there's a thickening on the wall of the gallbladder, and he went on and on. I said, okay.
So he found all that?
Well, that's what he told me. So
Yes.
he sent me for this ultrasound. So anyway, I went and I told the doctor, I said, okay. He did the ultrasound. He said, my dear, everything's in perfect shape. You have no thickening of the walls of the gallbladder. He said, your organs, everything's looking perfectly fine.
And tell us about the hiatus hernia
And so, well,
at this point.
I don't. Anyway, so I went back to him and I said, you know, I think I'm gonna defer surgery. Let me think about this a little more, because the more I read about it, is that well, you know what a hiatal hernia is, okay? It's where the esophagus joins the stomach and you have this diaphragm at the top and the whole stretches. It could be, you know, I was reading too that a lot of causes could be people who have asthma and stuff like this, who are, you know, constantly have chest problems, constantly coughing.
But what I'd like to get at is was the hiatal hernia resolved?
Well, no, as far as I'm concerned, I have a hiatal hernia.
Yes.
Anyway, now I'm being told I don't have a hiatal hernia.
That's the latest that your doctors have
Well,
told.
no. I went to someone else. This is a whole nother story. Because of course I went to a specialist who told me I had a hiatal hernia. But I was experiencing shoulder pain. I had a pinched nerve a few years ago. And this very wonderful chiropractor, I used to go to him. And I remember going to the doctor that's when I had all these health issues. And I had this pinched nerve, went to the doctor, got cortisone shots, all sorts of things, and I had pain 24/7. Pain wouldn't go. And finally, a friend recommended this chiropractor, so I went to him, and I was in excruciating pain.
And this was your back?
This was my back, my shoulder. Actually, the pain was just radiating all the way down my shoulder to my elbow. I mean, I couldn't even hold my hand up.
Was this a qualified chiropractor?
Oh, yes.
Okay,
Yeah,
formally trained.
Much so.
Yes.
Very, very much so. He's been in the business for years. And when I went to him, he really sympathized with me. Anyway, he sent me for some x-rays and stuff, and within 3 days after manipulating me and putting the machines on me and what have you, I was free of all pain. So what would happen is, like once a year, this thing would start, and I'll go to him, and as soon as the pain starts, I'll run to him, he'd manipulate me and put the machines on me. By the end of the day, I'll have no pain. Anyway, this wonderful doctor passed away.
I think I know the gentleman from Belmont.
Yes.
Well, he took care of my husband too, and he had excellent results. Excellent results.
Incredible.
Yes, I had lunch with him once actually, just by chance at Ellerslie Plaza.
Yeah. So he passed away, and I had this problem once again. So I thought, okay, what am I going to do about it? So I went to see another doctor, and they couldn't help me, and I bought a little machine and I put the electrodes on, and I got a little relief, but nothing much. Anyway, someone else, of course, recommended, you know me, I'll try a lot of things. So someone recommended someone else, and I had this cupping done.
That is very old-fashioned. You're talking about letting blood?
Yeah, no, cupping what they do is they put the alcohol in the cup. Actually, and the Chinese do this a lot. I have books on cupping that I've been reading, and so I knew.
So this is not removing blood from your
it
venous
isn't.
system.
But what it does is, and this is the thing, is that it helps with your circulation. And I remember when I went to do this thing. This was about 5 months ago, and because I have been doing so much research and I've been reading up on all sorts of things, I was acquainted with it. I hadn't done it before. Actually, I went to have acupuncture done on it, and believe it or not, it made the situation worse.
And all this is lower back pain?
No, this was radiating down.
That's what you had said, sorry.
Yeah. So when I went to this person, and then again, in his field, he's been doing this for many years. He's highly recommended. So when I went to him, he said to me, "But you're not dealing with the problem." I said, "What are you talking about?" From the minute he set eyes on me, he said, "But you have a pinched nerve." I said, "Yes, I know, but that was years ago." He said, "No," he said, "you're treating the symptom and not the cause." And I think this is what I'm preaching to my clients all the time, about all the problems, the signs that they're being manifested.
Was he able to treat the cause for you?
Yes, well, what happened was, he started doing the cupping from my ankles up. And you know what was so incredible about this whole thing? Is that he said to me, "You're going to be able to tell the difference right away." So he started cupping my ankles and working his way up. And he said, "Okay, bend your legs." And I was able to bend my legs and extend my legs. I mean, things that I couldn't do before I was doing. It was amazing.
Okay.
So then he said to me, he started cupping my back and everything. He said, "What's happening too is," he says, first of all, when he looked at me, before he even touched me, he realized that one shoulder was slightly lower than the next. And I thought, at my age, Loraine, you're doing real good. I mean, I had nothing to worry about. So I didn't think, one shoulder being slightly lower than the next. And then I had a little bulge at the back of my neck. And he said, "It's because of the pinched nerve." And he said to me, "If you don't have it treated, what's going to happen is," he said, "you have fluid leaking out of your spine here, at the top here." And he said, "you're going to have problems later on."
So was this guy a trained chiropractor?
Oh, he is. Oh, this guy has been...
because I know viewers want to know that, because we have a lot of people
this guy
doing
has been
different types of practice, no training.
He's worked with the medical corps. He is qualified.
Yes.
And what was most interesting, now I haven't had another ultrasound. This is something I need to check again about this hiatal hernia thing, but I'll tell you something. He said to me, when I had my problems, I had slipped once in the gym, and I don't know if that was the beginning of my problem. He said, what you did was, he said, you tilted your whole pelvis and everything out of shape. So that means your intestines and everything. He said that every time you eat certain foods, what happens is you feel like you want to bring it up, like you feel uncomfortable. So I said, all right. Of course, I took it with a pinch of salt. But then he brought up on his screen, he brought up the vertebrae, he brought up the whole system of the spine and what was being affected and what was happening and everything else. And I mean, he was well versed in what he was doing.
So in the end?
Anyway, to cut a long story short, he said to me, he said, you also, when you breathe, you don't use your whole diaphragm. I said, I know. I mean, I'm a very shallow breather. And I thought it was just poor habits over the years. And he said to me, he says, no, it's just that everything has been shifted. I said, well, I always felt that my solar plex was out of whack. And he started cupping my stomach and everything else to put the solar plex back in place. And I tell you something, it was like a gush of air just entered. My breathing has changed.
It has.
Tremendously. I mean, when I have an intake of air now, I literally feel it going all the way down to my
So you're like a new person then.
Oh, I'm transformed. Not only that, things that I would do, there's certain abdominal exercises that I wouldn't do, because when I was in the gym and I start doing them, I would get lower back pain. And so I would stop. As to me, a pain is a sign that something is wrong. Now I can do those exercises with no pain whatsoever.
That is very interesting. Yeah.
It is amazing. And my I was very flexible. I mean, I was always told in the gym that you're very flexible for your age. It's amazing. Well, now I'm even more flexible. It's amazing. What I can do with my body it's incredible.
Loraine, at this point, I think we're going to wrap up.
Yes,
and we're going to have to continue. We can continue. We can continue, but we'll wrap up for now.
What I just want to say is that people have to take charge of their own health. You cannot leave it in the hands of another person. And you need to listen to your body. Oh, your body talks to you. And it's so simple. It is so simple to just put it right. Eat the right foods. What you put in, you are what you eat. And you have to understand that. It took me a long time to understand that. But I believe the body can heal itself. If you just give it the right nutrients.
Thank you so much, Loraine. We really appreciate your time and your sharing. And I'm sure you've given everyone
food for thought.
More than food for thought. Thank you so much. Take care, Loraine. God bless.
You're welcome. God bless.